distinguished guests on the dais, awardees, ACC past presidents, Board of Trustees, Board of Governors, Assembly of International Governors, ACC staff, members, guests, families, and friends. Please extend my welcome again to the 63rd Annual Convocation of the American College of Cardiology. It is a privilege to be here tonight to welcome our newest fellows and associates. We share your joy on this special occasion of Convocation, which marks the 65th anniversary year of the founding of the ACC. Convocation is a ceremony of celebration, tradition, transition, and renewal. This evening's formal recognition of your many accomplishments is just the beginning of a lifelong relationship between you and the college. I want to congratulate each of you for your tireless work and dedication to the cardiovascular profession and to patients around the world. You are the future of cardiology and of the ACC. I want to talk a little bit tonight about history and about the future. William Shakespeare wrote in The Tempest, "What's past is prologue." This quote is engraved on the National Archives building here in Washington, D.C., as a reminder that history influences and sets the context for the present. Each of us is here tonight because of those who came before us. Cardiovascular innovators like Franz Grodel, Bruno Kish, Elliot Corday, Simon Dack, Jeremy Swan, Andreas Grunsig, James Dove, and so many countless others. The history of the American College of Cardiology and its members has strongly impacted contemporary clinical practice. Over the past 65 years, we have learned how to operate on a congenitally diseased heart, replace and repair its valves, restore life to patients following sudden cardiac death, control the heart's rhythm, bypass diseased coronary arteries, open diseased vessels, completely replace the heart, reverse a heart attack in progress, and inhibit the development of coronary artery disease. Because of these dedicated pioneers, we now have more options for treating even the sickest patients, from infants to the elderly. Taken as a whole, these men and women are why people around the world have a better chance of not only surviving cardiovascular disease, but living longer, healthier lives. These innovators are the context to our present, a present in which many of the issues we face are not that different from those faced throughout the college's 65-year history. Issues like information overload, practical use of guidelines at the point of care, global cardiovascular health, liability concerns, shifting practice settings, and workforce shortages. Addressing his colleagues in 1949, ACC founder Dr. Franz Grodel commended them for choosing to meet the future not merely by dreams, but by concerted action and inextinguishable enthusiasm. However, there are newer challenges driving rapid and massive change, both in the United States and globally. On the clinical front, statistics show that while huge strides have been made in treating cardiovascular disease and reducing mortality over the last several decades, heart disease continues as the #1 cause of death around the world. This trend is only being magnified by an aging population, the worldwide obesity epidemic, and the related growth in the prevalence of diabetes and other non-communicable diseases. Meanwhile, according to the Association of American Medical Colleges, a shortage of physicians is expected in the United States by next year, with this number predicted to increase across all specialties, including cardiology, by 2024. Given the growing demands for healthcare, integrated or team-based medicine is increasingly viewed as a means to address these looming shortages in the cardiovascular workforce. Team-based care also shows promise in terms of enhancing the quality and safety of patient care and expanding physician productivity and job satisfaction by reducing workloads and preventing burnout. Surveys of ACC members over the last few years support these claims. Of the practices operating in a team-based care environment, increased efficiency, improved quality of care, and increased patient satisfaction were the primary improvements cited. Economic and political factors are also key drivers of change. According to the ACC's latest environmental scan, the United States spent 17.9% of its gross domestic product on healthcare in 2011, a percentage that had actually leveled off after many years of increase. However, with the implementation of the Affordable Care Act, as well as other factors, the Centers for Medicare and Medicaid Services projects that total healthcare expenditures will reach $4.8 trillion in the year 2021, constituting 19.6% of the GDP, or $1 of every $5 spent. These economic and political changes are forcing the medical community to rethink the way it provides care and does business. One of the biggest and most direct reactions to these changes is the migration of independent cardiovascular practices to integrated and/or employed models. Other major external factors include increasing transitions to outpatient care, as well as greater oversight and regulations involving relationships with industry that have impacted the way educational programs, research, and fellowship career development awards can be funded. On the scientific front, while rapid developments in new healthcare technologies are providing patients with promising new advances, the pace of these changes is often overwhelming for care providers and patients. Organizationally, the ACC has also undergone its fair share of changes. In the past decade, the college has opened its doors to support all members of the cardiac care team, with the number of nurse practitioner, pharmacists, cardiovascular technologists, and practice administrator members exceeding 5,000. The trend toward hospital integration is also requiring the college to reach out to hospitals and other large facilities and tailor its offerings to meet the very different needs of the increasing number of members in a hospital environment. Other internal drivers include the ever-increasing use of digital technologies that involves major shifts in how information is communicated, learned, and received. There are also a growing number of opportunities to partner with other societies, industry, government agencies, payers, and others on educational programs, patient education, quality improvement, new cardiovascular treatments and therapies, health policy efforts, and more. The college has also seen significant growth in terms of clinical resources and tools. Development of appropriate use criteria is but one example of an unprecedented move by professional society to improve the value of care. In addition, the exponential growth of registry data through the National Cardiovascular Data Registry is not only providing physicians and care team members with crucial information, but is also evolving as a rich source of clinical data for research, post-marketing surveillance, and quality improvement. The college has broadened its reach globally, with international professionals now making up the fastest growing segment of the membership. The establishment of our 31 international chapters is continuing to foster this growth. Our new International Centers of Excellence pilot program is another way we are striving to enhance global cardiovascular health. Through sustained collaboration with our sister societies and the exchange of knowledge and resources for cardiovascular care worldwide, we will continue to move forward together, speaking with one voice as global advocates calling for cardiovascular disease prevention, treatment, and to reduce the burden of non-communicable diseases. All of the efforts mentioned above, as well as countless others, form a solid foundation for the next big phase of the college implementing the new 5-year strategic plan. The purpose of the strategic plan is to re-envision specialty care with the goal of positioning the ACC as the professional home for the entire cardiovascular care team. To accomplish this, the college is committed to increasing membership value and engagement, helping to transform cardiovascular care, and meeting the triple aim of better care, better outcomes, and lower costs. The plan also recognizes the ACC's role in providing members with purposeful education tools and ensuring that members are empowered to serve as effective advocates for sound health policies that allow patient access to the most appropriate, high-quality care. Supporting members in their expanded accountability to improve population health, as well as recognizing the importance of data, information, and the development of knowledge in both education and care transformation, are at the heart of the strategic plan. By empowering ACC members like you to become effective advocates for patients and cardiovascular professionals, as well as focusing on the college's strengths and building strategic partnerships, we can overcome the disruptions caused by the clinical and economic changes in the healthcare environment and ultimately transform the future of cardiovascular care around the world. Continuing to look ahead, the ACC remains committed to its members, their patients, and society, focusing on professionalism as a core value. While challenges abound, supporting practice excellence with tools to enhance quality and value distinguishes the ACC commitment to its members. Ongoing breakthroughs in science promise the opportunity to provide improved care, while advancing technology provides platforms for rapid dissemination of information. It is our charge to seize this opportunity to help the college evolve in the best fashion possible, to realize its full potential for its members, the patients they serve, and the global cardiovascular community. Our heritage in education, our extensive work in quality improvement, and our advocacy for quality patient care provide the foundation for success, and we will succeed. The role of the college in protecting society by promoting high standards of education and practice remains unchanged since 1949. The ACC has become a global knowledge organization, and fellowship is more influential and active than ever before, and carries responsibility to the profession and the public. As we move forward with implementing the new strategic plan, we can learn much from the leaders and innovators who came before us. Over the last 65 years, the dreams, actions, and enthusiasm of thousands of cardiovascular professionals have brought us to where we are today. It is now your dreams, your actions, and your enthusiasm that will take us forward into the future. We've come a long way since 1949, and I'm confident that the ACC's founders would be proud of what we have become and where we are going. Engagement with the college is an incredible place to start changing the landscape of cardiovascular care. I encourage you to volunteer with the college and become active in your local chapter and with the national ACC. Membership in the college means more than 4 letters after your name. It's both the foundation and the future of our profession. Your professional satisfaction lies in the joy of achievement and in the thrill of your creative endeavors. The future and the past demand nothing less of us. I wish to close by thanking the members of the Executive Committee, trustees, and governors for their wisdom and support over the past 12 months. I would like to acknowledge those giants who helped make me what I am today, the ACC leaders and staff who tirelessly work to fulfill the mission of the college, and the cardiovascular professionals around the world who've dedicated their lives to advancing the health of those living with or at risk of heart disease. To my partners and colleagues at the Cedars-Sinai Heart Institute, I thank them for their support and encouragement during my presidential year, and for my family who have been so supportive. Thank you for your trust and for the opportunity to serve. It has truly been a pleasure and a privilege to lead the American College of Cardiology. Let the deeds of our past serve as guides to our future. Thank you. My last duty as president is to pass on the torch. That is to turn the presidential chain over to your next president, Dr. Patrick T. O'Gara. Congratulations.
Well, we're both Irish, but I don't think anybody would miss the difference in height. I think John's relatives must have come from the eastern side of the island, and perhaps mine from the west. But John, it's fantastic to have you here at the podium for one last public recognition. As the newly elected president of the ACC, it is my first and most pleasant duty to present you with a plaque that is entitled "The American College of Cardiology expresses great appreciation to John Gordon Harold, MD, MACC, in recognition of his remarkable leadership as president of the college 2013 to 2014, Washington, D.C., March 31, 2014. John?